Welcome to the Rich Feet Podcast with Dr. Tanisha Richmond. This podcast is sponsored by the Richmond Foot and Ankle Clinic, where they specialize in happy feet. Each episode highlights the best of Dr. Richmond's radio show, providing bite-sized clips of advice. Let's jump right into the show.
This isn't about politics, and this isn't even just about saving money, which ACA does. It isn't even just about better outcomes. This really, literally is saving people's lives. So at this point, I'd like to introduce you to Tanisha Dr. Richmond.
Good morning. My name is Dr. Tanisha Richmond. I am an avid, lifelong supporter of the Affordable Care Act because the Affordable Care Act personally changed my life. 2008, I left residency here at the Dayton VA. 2008, I started my practice here at the Charles Drew Health Center. I am a podiatrist. 2008, I applied for health insurance. I am a diabetic. 2008, I was denied over and over and over again. And people always say, well, you're a doctor, how come you couldn't get it? They would not, for any cost, for any premium, give me a health insurance policy. And people say, well, you could have got it, and why didn't you get it? It was not an option. So for 2 years, I was uninsured, just like my patients. We expanded Medicaid here in 2014 due to Kasich. Prior to that, about 20% of my patient population here was uninsured. And I saw that daily, the cost of being uninsured. I had a patient who lost his leg because he was uninsured. He couldn't even afford the sliding fee schedule to be seen routinely. And as soon as they cut his leg off, he was given instant Medicaid. He was given instant benefits. He was actually given an instant leg. They paid for a new prosthetic limb. They paid for him to be rehabbed, retaught how to walk. He was given shoes with a filler. Everything was given to him once he lost his leg. And for the politicians, like Mr. Fred Strayhorn said, this is not a Republican issue. This is not a Democratic issue. This is a human issue. This is an American issue. When a patient goes to the OR and they're cutting off their foot or leg, they don't ask them if they're a Democrat or a Republican. All they know, they're about to cut their leg off. And statistically, when one person loses one leg, 50% of them will be dead in 5 years. If they lose both legs, 100% of them will be dead in 5 years. And by coming to see people like me, a foot and ankle specialist, I can help prevent that. When a person comes to me with a wound, we go after them aggressively. We're gonna check their vascular status. We're gonna get them wound care. We're gonna get them home health. Because I know as a physician, the likelihood of them losing a limb, and then I know the cost. The cost of an amputation is $100,000. The cost of routine foot care for me a year at the most is $300. And then the cost for diabetic shoes, which are paid for annually, is $300. So when you come to Congress, you can say, would you rather pay $300 or would you rather pay $100,000 for someone to lose their limb? And I think that's what we need to push to the Republicans and Democrats. This is not political. This is not political football to kick back and forth and say, oh, well, this governor did support this current president, so let's cut his funding. Because you're killing millions of people. And you're not only killing people, you're taking away people's jobs. I've been in Ohio practicing for the last 9 years. I have seen the increase in jobs from the healthcare market. I have seen it personally in my practice. I've been able to hire more employees, thus paying more taxes. And it benefits everyone, because then these employees now get healthcare, because now they have a job and they're off the rolls of disability and all these other things. They actually are gainfully employed and they're happy to have a job. And people are happy to have health care. I have yet to have a patient come in and complain about having health care. They want to go protest Medicaid. Or I actually had a patient who came in who worked for one of the big hospitals. She went out to the ACA and got a cheaper plan. And she was so happy. She told me, I just went to an ACA, I looked it up, and my plan is cheaper, my deductibles are lower. So they keep vilifying the Affordable Care Act. There's a lot of misinformation. Actually, I'll tell you my premium. I have a $1,000 deductible, I have dental and vision, and I only pay $370 a month. I have full coverage for my diabetes. So people need to understand this is life or death, this is everyday life, this is money, this is everything. But they need to understand it's not. And then I always bring up the note for President Trump. He's had the best health care since he's walked this earth. He has never worried about a deductible, never worried about a copay, never worried about the cost of medication. Whatever worried, can I pay my doctor? Or do I pay my light bill? So we need to come at him more personally and personally say to you, you have no idea what we're dealing with. You will never, and now he's about to get the second best health care. He's president. So we need to come at them with heart, passion, and understanding, and let them know we will not go out without a fight. And I don't want to get too political, but I think we need to have our own march too. So keep fighting, keep striving. The Affordable Care Act has saved millions of lives, improved millions of lives, and if it continues, it will continue to do so. Thank you.
We hope you enjoyed today's show with Dr. Richmond, sponsored by the Richmond Foot and Ankle Clinic. The clinic is located at 1323 West 3rd Street in Dayton, Ohio. Zip code 45402. To book an appointment, call 937-228-3668, or you can learn more at richfeet.org.